provide a brief overview of the NIDDK mission and an overview of our grant programs with an emphasis on the small business SBIR and STTR programs. And I understand many in the audience will have already watched some presentations from my NIH colleagues, so I've kept the general content on the SBIR STTR programs brief. However, if you're looking for more general content, please visit the brand new website from NIH's Small Business Education and Entrepreneurial Development, or SEED office. That's SEED, SEED.nih.gov. So what are SBIR and STTR? These programs are together one of the largest sources of early stage capital for technology commercialization in the United States. They allow US owned and operated small businesses to engage in federal research and development that has the strong potential for commercialization. The SBIR program funds early stage small businesses that are seeking to commercialize innovative biomedical technologies, and the STTR program is similar, but requires that a small business formally collaborate with the research institution. And there are some additional differences related to the PI, or principal investigator, employment, and the minimum levels of research or analytical effort for the small business and the research institution. And there's a great deal of additional information, again, on the SEED website, which you can see in the lower left-hand corner. From an entrepreneur's perspective, there are several benefits of this SBIR and STTR funding. Again, this is the largest source of early stage capital for life sciences in the US. It is non-dilutive capital and not a loan. Data and intellectual property rights are protected, and awardees can leverage this funding to attract other investors, as you can see in this chart. As you can see, again, these programs generally support activities around proof of concept and for the technology, as well as continuing the R&D. This may have followed basic research discoveries that supported by other types of research grants, and I'll come back to that a bit later. In brief, these are phased programs where the objective of phase 1 is to establish the technical merit, feasibility, and commercialization potential, as well as the performance of the small business. And if successful, phase 2 is then to continue the research and development toward commercialization. There are multiple paths, and I'm happy to discuss these with you in the context of your individual project. Briefly, there are fast track applications where phase 1 and phase 2 are combined. And there's also a direct to phase 2 application type where phase 1 equivalent work is demonstrated, and that would have been performed without SBIR support. There are also phase 2B and commercialization readiness pilot programs, which can provide even more support for those projects that require it to get to the commercialization phase. Here are the current CRP funding opportunities that NIDDK is participating in. There are also several technical assistance and business education programs offered to grantees to help companies move along the path toward commercialization. Transitioning back to NIDDK scientific areas, the research mission of the NIDDK is quite broad and includes many chronic, common, consequential, and costly diseases, from diabetes to obesity to liver diseases to chronic kidney disease to incontinence. To address this mission, the NIDDK's Extramural Research Program is organized into 3 scientific divisions: the Division of Diabetes, Endocrinology, and Metabolic Diseases, the Division of Digestive Diseases and Nutrition, and the Division of Kidney, Urologic, and Hematologic Diseases. And NIDDK has program directors for each of these divisions who can advise you on the fit of your project for a mission and identify appropriate funding opportunity announcements. And I'll have their names for those SBIR and STTR program directors on the last slide. The next few slides will attempt to introduce our mission areas, but are not meant to be comprehensive. The Division of Diabetes, Endocrinology, and Metabolic Diseases mission includes diabetes prevention, diagnosis, and management, acute and chronic complications of diabetes, other endocrine disorders, obesity and energy balance, cystic fibrosis and its metabolic impact. We have awarded SBIR and STTR grants in the area of continuous glucose monitoring and insulin delivery technologies, including integration of these into an automated artificial pancreas system, smart insulin, glucagon, and novel drugs for glycemic control, multiplexed antigen panels for type 1 diabetes, technologies to support cell replacement therapies for diabetes, and wound healing and diabetic foot ulcer treatments. The Division of Digestive Diseases and Nutrition includes research on digestive diseases, including the alimentary tract, liver, and pancreas, nutrition and nutrient metabolism, obesity, including type 2 diabetes, energy balance, and neurobiology. And we've supported SBIR and STTR grants in the areas of technology for visualizing and automated analysis of GI motility, clinical assays for the genetic causes of liver disease in children, an immunoassay for studying iron regulation and assessing it clinically, wearable technologies for caloric expenditure, and animal models of metabolic syndrome and obesity. The Division of Kidney, Urologic, and Hematologic Diseases includes research in kidney diseases, urinary tract diseases, and disorders of blood and blood-forming organs. And our SBIR and STTR programs have supported grants in the areas of animal or 3D culture models of kidney diseases, including polycystic kidney disease, improved measurements of kidney function, hemodialysis vascular access technologies such as novel grafts or approaches to enhance AV fistula maturation, materials for urinary and dialysis catheters which resist fouling, and assays for key iron regulating hormones to diagnose blood diseases. The NIDDK supports R&D throughout the innovation pipeline from basic science discoveries through clinical trials. Now on the screen here are idealized graphics. The process is rarely so linear. It's often iterative. There are pivots, and different teams might be taking an innovation through different stages of its development. First, it's important to note that we have flexible programs to support investigator-initiated research at any stage, basic, translational, and clinical. Our research project grants, or R01 grants, support discrete, specified, circumscribed projects, and our SBIR and STTR programs support R&D conducted by U.S. small businesses that have the potential for commercialization, usually shifted toward the right side of this pipeline. We also have initiatives to support broader unmet needs, gaps, and opportunities. And this graphic is not meant to be comprehensive and is weighted towards some of the programs in the division that I represent, as I'm more familiar with those programs. But we have many programs spanning NIDDK's broad mission. And I'll highlight how one of these programs could stimulate this pipeline. So the Kidney Precision Medicine Project, or KPMP, is a multi-year collaboration of leading research institutions to study patients with kidney disease and better understand the mechanisms of acute kidney injury, AKI, and chronic kidney disease, CKD. Although AKI and CKD impose a significant global health burden, no effective therapies currently exist for AKI, and only a few for chronic kidney disease. AKI and CKD have historically been described as single uniform diseases. However, there's growing consensus that these are interrelated and that different disease pathways lead to different subgroups of AKI and CKD. In other words, AKIs and CKDs. Access to human kidney biopsy tissue is a critical step to define disease heterogeneity and determine the precise molecular pathways that will facilitate the identification of specific drug targets and ultimately enable individualized care for people with AKIs and CKDs. Broken out, the goals of the KPMP are to identify new treatments for kidney disease, ethically collect kidney biopsies from participants with AKI or CKD, create a kidney tissue atlas, and define disease subgroups. Given the risks of complications from kidney biopsy, the KPMP has and will hold ethical and participant safety considerations paramount. The KPMP works closely with diverse patient partners, for example, patients serving as study investigators, and with KPMP participants to ensure their viewpoints, priorities, and preferences inform all aspects of the project. Participants have insurance through the consortium, and participating medical centers will not charge them for costs associated with complications related to these research kidney biopsies. At the end of the day, the KPMP aims to answer these questions for people with kidney disease. What do I have? What will happen to me? What can I do about it? And what does it mean for my family? And ultimately, biomarkers for subgroups of CKDs and AKIs for disease pathways and targets for novel therapies will support a precision medicine approach where doctors will be able to give the right intervention for the right patient at the right time. Tying this back to the SBIR and STTR programs, the KPMP, like many of our programs, recognizes that it must collaborate with a broader research community to fully achieve its goals. There are data, biosamples, protocols, and opportunities for ancillary studies, and more on the KPMP website. Furthermore, you can learn about the progress thus far on the website or via Twitter. And we're looking for technologies to support kidney precision medicine research, as well as projects involving translation of kidney precision medicine discoveries and technologies. We outline some areas of interest in this Notice of Special Interest, Notice DK 21007. Next, I'll cover the funding opportunities for small businesses. Small businesses are eligible to apply for many opportunities open to research institutions, but I'll note that the SBIR and STTR programs are supported by a set-aside pool of funds available only to small businesses. Grant applications are submitted to funding opportunity announcements. You can find these funding opportunity announcements or FOAs that we participate on in several locations. The NIDDK website is on the left here, and the SEED website is on the right. Most applications are submitted to what are called the parent or omnibus FOAs. These FOAs do not target a specific topic, but you can review NIDDK's program descriptions and research topics that are linked in these FOAs. We are participating in 3 of the 4 omnibus FOAs, accepting clinical trials only through the SBIR program, not the STTR program. The standard dates for these funding opportunities are September 5th, January 5th, and April 5th. But please do review the specific funding opportunity that you're targeting, as some use different dates. We have a handful of targeted announcements in different types of funding opportunities. These 2 requests for applications, or RFAs, are related to our type 1 diabetes program. These RFAs with due dates this year, as you can see, in March and October, as you can see, are not standard dates. These invite applications to develop glucose control technologies and support their integration into open and closed loop hormone replacement systems. And the other is on improvement of cell replacement interventions. We have also expressed interest in applications in a few areas through notices of special interest. These typically refer to the omnibus or parent announcements. These 2 are on improving methods to assess body composition in infants and young children ages birth through 5 years, and on developing swallowable smart pills or devices to advance precision nutrition, microbiome, and gastroenterological research. We are also interested in innovative approaches to renal replacement therapy, including vascular access and fluid management during dialysis. And as I've mentioned, we're also interested in technologies to support kidney precision medicine research, for example, by improving kidney biopsies or molecular and clinical phenotyping tools, as well as to translate kidney precision medicine discoveries, whether they are derived from the KPMP or other programs, and associated technologies. So for example, that could be diagnostic or predictive tools based on automated analysis of digital pathology, multiomics, or clinical data. The NIDDK is also participating in the reissue of an RFA on innovations for healthy living with the goal of developing products, processes, or services for commercialization with the aim of improving minority health and or reducing and ultimately eliminating health disparities in one or more NIH-defined population groups who experience health disparities. Appropriate technologies should be effective, affordable, and culturally acceptable. Applications are due April 4th. I believe that's the day before the standard date this spring. Lastly, the NIDDK is participating in the SBIR STTR diversity supplement program. So current grantees, typically phase 2 or phase 2 grant 2B grantees who can provide a strong research and entrepreneurial experience are eligible to submit an administrative supplement request to enhance the diversity of the research and entrepreneurial workforce by recruiting and supporting students, postdocs, and eligible investigators from diverse backgrounds, including those from groups who have been shown to be underrepresented in health-related research, women, and socially or economically disadvantaged individuals. There are other requests for application and notices of special interest that I may not have highlighted in this presentation, but hopefully the two tools that I outlined earlier can help you find a comprehensive list. And I'll leave you with this message. I believe similar to my colleague in the previous session. Please do contact us, ideally with a draft of your specific aims page, and ideally with ample time before the receipt date so that we can set up a call with you as necessary. And there are great resources on the SEED website, again, seed.nih.gov, and you can find the SBIR program directors from the 3 divisions listed here. And you can find their contact information on either our website or by searching Google for our names. Thank you for listening.
Thank you so much, Dr. Gossett. Do we have any questions? We have a few minutes here.
Dr. Gossett, would liver cancer fall into the division of digestive diseases and nutrition? Do you do cancer as well?
No, not likely. Please do feel free to send a project summary or abstract to Chris Densmore to confirm, but in most cases, the NIDDK supports research in benign diseases, and malignant disease would be assigned to the National Cancer Institute, though there may be some niche exceptions to that.
Thank you.